I am super excited to be talking with Mel Hopper Koppelman, the director of evidence-based acupuncture, not to mention someone who has been doing research and speaking around the world about acupuncture and making great strides for our field. And there's a lot more to her, but I'll let her fill you in. Hi, Mel.
Hi, thank you so much for having me. And I really appreciate the opportunity to speak with you and to listeners who hopefully will benefit. So thank you for that. Yes, I'm director of evidence-based acupuncture, and I'm also an acupuncturist and functional medicine practitioner based in Rhode Island, United States. So I'm doing practice and I'm doing the directorship.
And didn't you build a clinic recently?
I did, yes. So
that's fantastic.
Yeah, thank you. Hopefully, you should come visit sometime. It's we're really pleased with it. I trained and was based in the UK for 5 years, and then we moved to Rhode Island a year ago, and we found a property that had like a dilapidated, falling down old barn, which then we were able to redo into a clinic. So that's been open for the last few months.
Oh, that's great. I think that's super cool. What inspired you to create or take over evidence-based acupuncture?
Oh, that's a good question. So I took it over. So it was created by Bartosz L.A.c, who's a Polish MD and Chinese medical practitioner, fantastic guy, so lovely, so full of heart, and a teacher. And he, like many people around the world, realized the need for a resource about acupuncture's evidence, using the language of science and using the dominant terminology of conventional medicine. And he got tired of listening to people talk about how they were going to do it, which I think a lot of us have been in that situation where meeting after meeting, agrees it's a good idea, but nothing happens. Right. So Bartosz created the website in 2014. He had it translated, not pristinely, but it was a good start by a friend. And then it was kind of sitting there for a few years. It was a project that was certainly bigger than one person, and he had, has a lot of other things going on. And so it languished a bit. And so I met Bartosz over the years at different conferences, and we became friendly. And at a certain point last year, he asked if I'd be interested in taking it over, that he, was very proud of what he had done, and he had done something very wonderful, and that it just needed some new life. So for me to say yes was a natural progression. This is something that I'd wanted to do for quite a few years as well. I started writing about acupuncture research, particularly speaking to a lot of the skeptical arguments and a lot of the criticisms.
And you've done it well.
Thank you.
You've done it well.
Thank you. It's been that I've had a lot of fun with. I think if you don't, if you can't laugh at it, then it gets a little bit too.
No, I actually, one thing I have definitely enjoyed, while they don't happen often, is hearing the threads of conversations that you have had very respectfully, but with some skeptics.
Yeah, no, so that's been good. And I think, not to jump around too much, but with those conversations, I think I became interested in what the skeptic arguments were while I was training. My mom is a retired physician and medical researcher. I was raised by a skeptic. And so I have respect for that way of thinking, even though it has its limitations. So it's not a complete way of thinking, but it's certainly an important aspect of being, an intelligent decision maker in the modern world.
Yes.
And so I was curious about what skeptics had to say about acupuncture and acupuncture research. And I was really disappointed with the weakness of their arguments when I started reading about it. And I was also disappointed that really, except for a few little jabs, there wasn't really anybody challenging them. So, so then that's when I decided, what, I'm going to have a go at this and really just look at their arguments and really, ask some questions, because this isn't accurate. This isn't the result of really accurate, thoughtful thinking. There's a lot of logical flaws in what you're saying. And so that ended up starting an interesting conversation. But at the same time, with evidence-based acupuncture, there still was this need for a resource for acupuncturists and their patients and anybody who's I speak with a lot of people who have been given the opportunity to give talks at hospitals or medical surgeries, and they want to have some, some support and that sort of thing. And we really should have something like this. A lot of time over the years, deep diving into the research, both on acupuncture and on conventional medicine. And I feel strongly that in many cases, acupuncture constitutes the kind of the option with by far the better effectiveness to harm ratio than what's being offered. And so we can really help people and sometimes save lives if acupuncture is available and recommended as a first-line treatment where appropriate. So that's like the primary drive of the project. And so we're doing that in a number of ways. We are developing evidence-based resources around acupuncture for different clinical conditions. And this is a group effort by volunteers, so we get writers from different places. And I propose a very specific format for this for a number of reasons. So they're not particularly long, which is, I think, where it needs to be. They just need to be long enough. We have a brief introduction into the clinical area, whether it's plantar fasciitis or anxiety or cancer pain. Then we go into the clinical evidence for acupuncture for that condition. And last year, there was an update to 2 previous reviews that looked at acupuncture for every condition for which there's research. And for 46 conditions, they found moderate or strong evidence of effectiveness. So we're starting with those because that's why.
That's great.
Right. So,
I was just going to say, one of the things I think should be made clear is when someone asks you to give them proof, what I love about your site is I can go there and look under pain and get not only summaries and explanations, but everything is, or is it annotated the correct word? Or
it's referenced.
Thank you. It's so you have all the references there, so that way if you say to somebody, well, looking at the data, there's 46 conditions that I think acupuncture is better for. Well, where'd you get the data? Here you go. So I love that.
Oh, thank you. Fantastic. I know it has to be referenced, and really there's so much on the internet where people say like science says this and research says that. And it's like, science and research don't say anything. They're not only people say things, right? So we need
people interpret.
People interpret, people, refute, people, they do all sorts of things, but research and science, while they are great institutions, they don't do any, they don't speak. So it is fully annotated, fully referenced, and so people can get that sense. And then, so we're starting with conditions for which there is good evidence. So we are summarizing that and pointing people to those studies. Then we give a review of other treatments for those same conditions. And this is really important. And as far as I can tell, very seldom, if ever done, because there's almost like this misconception, like because we're not conventional, we're not allowed to comment on conventional medicine, which is really strange logic to me, because any patient or doctor is choosing treatments amongst options, right? So, and that's where you decide whether it's good to go for acupuncture or not. It doesn't exist in a vacuum. And frankly, if I came across a treatment that worked better than acupuncture for a particular condition, I would recommend that, right?
Yeah. Oh, I actually have definitely even recommended to patients, if it's something I don't think I can do well with, I will refer them out. But I would say acupuncture needs to be more recognized, just like you're saying, and we should have a voice.
Yeah, absolutely. It needs, and just to really stimulate people's thinking around it, because when someone's, I'm always very fascinated about when people speak, what are the things that they haven't said that underlie what they're saying. So if someone says to you, what's your proof that acupuncture works? I can almost guarantee that they're assuming that conventional medicine has good evidence. So there's an assumption built in there.
Yes. That is a very good point.
Right, not 100% of the time. Some people would question everything, but not most people don't question everything. Most people accept the conventional medicine as being evidence-based. So when they ask you, well, where's your evidence? That's where the assumption is. And so it's really important for us to present that information at the same time. I've been completely amazed, and I continue to be amazed by the lack of evidence for so many commonly recommended treatments. It blows my mind.
I read that on your site. I read that, and it blew my mind. And could you speak to that a little bit more?
Yeah, sure. So there's a few things about that. So the most recent review that we put out was just summarizing the evidence base in general for acupuncture. And then we looked at the evidence in general for conventional medicine, which is a little bit sloppy, but global. And we found a number of very high quality, well-respected reviews from the Mayo Clinic, from the American Heart Association. These are not fringe groups that found that around 50% of procedures were actually backed by solid evidence. That's a coin toss. So when you think about how expensive and invasive most of conventional medicine is, then you really need to be honestly asking yourself if that's a good direction to go in. And I want to make a slight distinction here. I feel very differently about emergency medicine versus medicine for chronic issues, right?
Okay.
We need to be using the appropriate lens or model for the condition. So if someone has an emergency, then we don't really need to go into, all this extra stuff or ask them about their childhood or anything like that. That's a different priority. And conventional medicine really is state of the art at saving lives and putting people back together. And advanced surgical things and everything like that. But when we're talking about the top, I think it's about the top 10, if not 20 causes of disability and death in the in the Western world, these are chronic issues. So these are cardiovascular disease, diabetes, obesity, depression, all of these things that are not emergencies until they are, of course. And so there's, I think it's not evidence-based, or at this point reasonable to assume that when you go to a doctor, what they are recommending is based on solid scientific evidence. The evidence to support that.
Let's say that one again, because I think that just sums up everything you said. Is just because a doctor is recommending it does not mean that there is solid evidence behind it. Correct?
Right. That's correct. And the most up-to-date evidence in these reviews that I found was that about 50% of the treatments are backed by evidence. And this is not at all, if we look at how healthcare systems work, then this is not to blame the doctors. The doctors many times are doing a good job of what they're meant to be doing, but they have to assume in order to do their job that guidelines that they're being given is based on good evidence, or that what they're taught and told to recommend, and many of them believe that. But if we actually look at the primary research, it doesn't support that.
Okay, no, and that's true, because doctors are doing their best and they're working with the knowledge they have. So that's so interesting, because 50% of treatments or recommendations do not have solid evidence behind them. Now, let me ask you, what is the percentage with acupuncture?
Well, I suppose we need to look at it two ways. So one thing is that when we're looking at acupuncture for all of these different conditions, then that's where we're trying to conform to the conventional model of these discrete diagnostic entities, some of which are kind of made up, even if we look at it from a biochemical level, right? That they're not real, but we've named them. So we're looking at acupuncture for migraines, acupuncture for anxiety, acupuncture for all of these different things. And so for, as I mentioned before, there were 46 conditions for which there was moderate or strong evidence for acupuncture's use. But then if we kind of step back a little and look at how we know that acupuncture is working, there's, a lot of different biochemical mechanisms and physiological mechanisms, bioelectrical mechanisms that we have measured and mapped and know of over the last 60 years. But, the beautiful thing is that we know that a lot of them they result in improved self-regulation, which is good for most things. So we can get more specific and talk about specifically which mediators are associated with improved cardiovascular function, which we know of a lot of them, versus nitric oxide and different things like affecting the health of the cardiovascular system. We can or at a different clinical entity like migraines, where we know that it's affecting something called CGRP, which the pharmaceutical industry is in the process of developing.
What is CGRP?
Right. Oh, sorry. Okay. Yeah, we've gone a little bit deep. So that's calcitonin gene-related peptide, and
Okay.
so we know there are different types of migraines, and in our model in Chinese medicine, we're very good at identifying those very quickly.
Yes.
But the one thing that they pretty much all seem to have in common is that there's this, there's a trigger of inflammation, and then there's this kind of wave of discharging it that kind of goes through the brain, and that something called calcitonin gene-related peptide, CGRP, seems to be the kind of step that happens before the migraine happens.
So is that what's released and kind of goes through the brain?
Yeah. Yes, it seems to be the kind of the final trigger before this change in electrical activity, which is probably a protective mechanism from the brain kind of zapping or overdoing it. And so using the model of conventional medicine, they're looking at CGRP equals bad, and they're creating antibodies to it that they'll inject, and that'll be available in a year or two. The problem is CGRP is not bad. CGRP, more CGRP is associated with improved cardiovascular health. So I fear that once the people have been using these for 5 or 10 years, we'll see an increase of cardiovascular problems. But of course, that'll be 5 or 10 years after people have been using them. But acupuncture is able to modulate that. And the thing is, it's the same acupuncture. It's the same stimulus, because yes, there's a sense in which we have these different specialized functions in the body. So we have, eyes and brain and muscles and all these different body parts, but there's also a sense, there's certain things that are the same in all cells, that are the same in any tissue in the body. And the way acupuncture works as a stimulus, it's always impacting that system. So when you ask about the evidence for acupuncture compared to conventional medicine, we're just doing something a little bit more on the level of improved self-regulation. The kind of comparison I would make, because in some ways it's similar, is exercise, right? We all know and accept that exercise is good for health and it's good for a lot of things. And you could start naming all the different conditions that it's like going to be productive or good for, which, maybe that's silly or not. But the bottom line is that people who take appropriate levels of exercise have a lot of different changes that tend to be positive if they do it right. That's the same type of stimulus that acupuncture gives. It's a similar type of input into the body, where we're affecting communication on a cellular level, that if we were to drive a nail through our thumb, that would cause pathology. But if we
but it would still have a reaction.
Then we now know from over 60 years of research that that's a very helpful thing lots of times.
Right. It's a protective mechanism.